Hey everyone, and welcome. Today, we're going to dive into one of the most common, but let's be honest, one of the most confusing pieces of your health data, your lipid profile. It's time to finally make sense of what all those numbers really mean.
I mean, you're not alone, right? You get this piece of paper, it's covered in acronyms, LDL, HDL, triglycerides, and a bunch of numbers next to them. It can feel like you need a secret decoder ring just to understand it. Well, that's exactly what we're going to do today. Translate that medical jargon into plain English.
All right, to get started, let's meet the main characters in the story of your heart health. You can seriously think of them as a cast, where each one has a very specific job to do inside your body.
Okay, first up, we've got the one everybody's heard of, LDL, or low-density lipoprotein. Yep, this is the infamous bad cholesterol. Its job is to carry cholesterol out to your cells, which is necessary, but when you have too much of it, it starts dropping that cholesterol off in your arteries, where it builds up into this stuff called plaque. And that buildup is a huge driver of heart disease. Now, on the flip side, we have the hero of our story, HDL, or high-density lipoprotein. This is the good guy. Think of HDL as your body's own cleanup crew. It zips through your bloodstream, scoops up all that excess cholesterol, and hauls it back to the liver where it can be safely removed. So for this one, higher numbers are definitely better.
And then there are triglycerides. Now, these aren't actually cholesterol. They're another kind of fat, or lipid, that your body uses for a quick energy boost. They're an important supporting character for sure. But when their levels get too high, especially when you've also got high LDL or low HDL, well, that's a combination that can really crank up your risk for heart disease.
So, if you want to boil it all down, here's the dynamic. LDL is like a delivery truck that can end up causing massive traffic jams in the highways of your arteries. HDL, on the other hand, is the tow truck that comes along to clear the wreckage and keep traffic flowing smoothly. The bottom line is simple. You want fewer delivery trucks and a whole lot more tow trucks. Keep that LDL low and keep the HDL high.
But, if it were all that simple, we could just end this explainer right here. The real story is actually a lot more complex. It's not just a simple good versus bad story. Turns out there are other lesser-known players on the field that are incredibly important.
So, let me introduce you to something called remnant cholesterol. It's basically what's left over from those energy-carrying triglyceride particles. And what's really fascinating here is the new research that's coming out. It shows that for certain conditions, like peripheral artery disease, or PAD, remnant cholesterol is actually a stronger predictor of your risk than even the famous bad boy, LDL.
So, why are we obsessing over all these different characters in your blood? Well, because they're not just numbers on a page. They are direct clues, directly linked to some of the most serious health issues out there. Let's really connect the dots between these lipids and what they mean for your health down the road. This chart really lays out what's at stake. An unbalanced lipid profile isn't just a single problem. It's a risk factor for a whole host of issues, from the obvious ones like heart disease and hypertension, to things you might not expect, like certain cancers and even cognitive problems. And hey, look who shows up again. Remnant cholesterol, linked to both PAD and hypertension. It's a bigger player than most people think.
And don't think this is some rare fringe issue. One major study found that over half, 51.7%, of the population already at high risk for heart problems have LDL levels that should be treated. That's literally more than 1 out of every 2 people in that group.
Okay, I know that all might sound a little bit grim, but here's the most important part. These numbers are not your destiny, not even close. You actually have a pretty significant amount of control over your lipid profile. So let's talk about how you can take charge of this story.
Diet is without a doubt a huge lever you can pull. Just look at this. This study on a high-fat diet shows how dramatic the impact can be. In this case, the bad LDL and the triglycerides shot way up, while the good, protective HDL totally plummeted. I mean, that's pretty much a recipe for disaster right there.
But check out the flip side. Just getting in some moderate intensity exercise can start pushing your numbers back in the right direction. It gives that good HDL a nice little boost and starts bringing the bad LDL down. It is an absolutely powerful tool for rewriting your health script. And listen, it's not just about doing one single thing. You've got a whole toolkit you can use. Different ways of eating, like the Mediterranean diet, staying active, and even when you eat can make a difference. And of course, there are incredibly effective medications and even some alternative therapies that studies have shown can nudge these numbers in the right direction.
Okay, so we know what the numbers mean.
and we know we have the power to change them. But there's one last absolutely crucial piece of this puzzle we have to look at, and honestly, it reveals a pretty shocking gap in how we're actually managing cholesterol today.
This quote right here from a recent study is just wow. It's basically saying that a lot of the time, even doctors believe their patient's cholesterol is under control when, in fact, it isn't.
And this chart really puts that into perspective. It shows just how huge that overestimation is. In one study, doctors thought over 54% of their high-risk patients had their LDL under control. But the reality, when you actually measured it against the official clinical guidelines, it was less than 13%. That is a massive, massive disconnect. So, what's the big takeaway here? It's that perception is not reality. Just because you or even your doctor thinks everything is fine doesn't mean it actually is. This just screams for the need for careful, guideline-based management and really following up.
And all of this brings up another question. Are we even measuring the best thing? The standard test, LDL-C, measures the total weight of the cholesterol in those bad particles. But think about it. If you wanted to know how bad traffic was, would you weigh all the cars? Or would you just count them? Well, a different test, for something called ApoB, actually counts the number of potentially dangerous particles. And a lot of experts now believe this is a way more accurate way to measure your real risk.
So after going through all of that, what's the big picture? What should you really take away from all this? Well, it's really all about shifting your focus from just a single number to your entire health story.
Really, it boils down to these 3 simple steps. First, get to know all the characters in your lipid profile, not just the famous one, LDL. Second, please remember these are just clues. They are not a life sentence. You can change them. And finally, use what you know now to have a much deeper, more informed conversation with your doctor about the entire picture of your health.
And that leaves us with one final thought to chew on. You know, with what we're learning about other players like remnant cholesterol, that shocking gap between perceived control and reality, and with more advanced measurements like ApoB out there, we really have to ask ourselves, is our old, simple focus on just bad cholesterol enough to truly understand our risk? It's something to think about. Thanks for watching.